Safety precautions for seniors. A low-carb diet can potentially bring about health risks, particularly for growing adults aged 65 or more. It might often cause some issues, many of which are pretty critical. While the keto diet provides rapid results, it is also safe to proceed with medical advice and guidance. Speak with your doctor about your desire to go on a keto diet program. A senior keto dieter should also be careful about regular doctor's appointments, blood pressure monitoring, and doctor checkups. Some factors require immediate medical care and guidance with the keto diet, as with any other diet. Following a low-carb, high-fat keto diet can help you lose weight. However, it can also spike your cholesterol levels. If you have diabetes, then the keto diet may put you at an increased risk for hypoglycemia. Suppose you are using medicinal treatments or have health problems, including liver or pancreatic issues. In that case, this diet can increase your risk. Type 1 diabetics are at a higher risk, usually for DKA. Women with a history of gestational diabetes should avoid the keto diet. Electrolyte imbalance. With both of these, we need to take extreme precautions before starting this diet and continue to do so daily. During electrolyte deficiency, your body loses minerals like potassium or magnesium. This can be a common risk for several people, especially seniors. Most commonly, a lack of intracellular magnesium and potassium is the most severe type of electrolyte imbalance occurring in the elderly or prolonged undernutrition. This also happens when you first start the keto diet, since you automatically lose a ton of water without the carbs, causing dehydration, which leads to an imbalance of electrolytes, resulting in what exactly? The keto flu. They affect the brain, nervous system, and heart function. It is one of the body's primary mechanisms for communicating about energy production. It must stay balanced for normal function and must be addressed. Be sure to take in a higher than average daily dose of multivitamins when starting the keto diet. If you are currently experiencing heart problems, or if you are elderly, have a kidney condition, or some other chronic health issue, you also need to make sure to talk with your healthcare provider before starting this diet. Dehydration risk. A keto diet can cause the body to shed water. The kidneys and body need to solve the imbalance. Consequently, the body, through urination, causes you to lose a lot of water and all the electrolytes in balance. Make sure to drink plenty of water and include some healthy salts, full-fat dairy, avocados, or fatty fish in your meals. Signs of dehydration include increased thirst, dry mouth, increased rate, decreased urination, and fatigue. People may also experience rapid breathing and confusion. Older people are particularly at risk for dehydration. Changes accompanying aging may hinder thirst perception. When dehydration occurs, confusion and impaired motor functions are common signs of concern in older people. Some individuals have electrolyte disturbances that require therapy, particularly in cases of dehydration. Such treatments ordinarily take place in a healthcare or institutional setting. In conclusion, the keto diet can benefit older adults. However, it is essential to supervise food and fluid intake in this population, carefully monitoring signs of dehydration. Medication interactions. Some medications are processed by the body using the same metabolic pathways in the liver as ketones. By metabolizing ketones faster than expected, some medications may be less effective. Research has shown that some medicines may present negative interactions. In contrast, other medications present positive interactions about their desired results. Suppose you are on valproic acid, oral corticosteroids, sulfonamide antibiotics, or insulin. In that case, you must consult with a pharmacist and your healthcare professional to discuss whether or not a ketogenic diet is a good diet for you. Any medication decisions should only come from a detailed conversation between you and your healthcare professional. Nutrient deficiencies. The ketogenic diet may create nutritional deficiencies for some people. It is primarily a high-fat diet that cuts out many standard carbs, fruits, whole grains, and certain vegetables that can be high in carbs, such as potatoes, peas, and corn. The reduction causes dieters not to get their fair share of vitamins, minerals, and other nutrients in these common foods. The diet tends to limit the variety and amount of dietary sources, resulting in less than the recommended intake of several vitamins and minerals. Nutrients of concern are usually found in fruits and vegetables, such as vitamin C, A, folic acid, potassium, and magnesium. The diet can be low in fiber and found in whole grains, fruits, and vegetables, which can cause constipation. Most importantly, it is essential to specify that evidence-based advice is for everyone across the lifespan. The best evidence is needed to guide dietary recommendations for different conditions, comorbidities, and frailty. There are also even more significant risks for supplemental toxicity among seniors, who are also home to a variety of dental issues. Low dietary fiber, leafy green vegetables, and carb-containing foods are the prominent sources of fiber in the diet. Diets depleted in fiber can have negative health results, mainly in seniors who are already particularly vulnerable. Potential long-term negative consequences include an elevated risk of swings in blood sugar, heart illness, cancer, and diverticulitis. Conclusion and recommendations. In conclusion, the self-reported benefits of the ketogenic diet are consistent with the scientific knowledge about the body's metabolism and the mechanism of action of the diet. This cohesiveness again stands in positive contrast to the confusion and uncertainty that characterize the understanding of obesity and dietary management. The effectiveness of the ketogenic diet, combined with the simplicity, taste, and wide acceptance of the available foods and meal patterns, makes it a powerful tool for the medical management of obesity, since it allows a diet rather than medicine to regulate body metabolism and utilize the healthy body's unique capacity for balance and adaptation. The ketogenic diet approach seems ideal for achieving long-term success. In recommending or using the ketogenic diet, we suggest the following components: an educational workshop comparable to that offered to the present patient group. Professionals should provide freedom from concerns about testing of ketonemia and counsel for psychological influences and impact on usual medications. Physicians are willing to act as a familiar and supportive guide for their patients' reactions and eagerness to change shopping, meal preparation, eating routines, and coping strategies for altering social and cultural patterns. Summary of key points. Seniors can greatly benefit from being on the keto diet to help reduce their suffering from many chronic health conditions. However, it is critically important for the safety of the seniors on the keto diet that caregivers responsible for their care or seniors considering starting the keto diet are educated on how to carry it out safely. If this is not done, seniors can unknowingly run into some severe health problems. Outline the safety precautions and potential risks for seniors on the keto diet so that their care can go smoothly and safely. Areas that will be covered are whether elders need to follow the classical keto diet or not, at-risk seniors, frequent hospital visits, weight loss caution. Compliance is essential for ketosis, complications of type 2 diabetes, CNS problems, dehydration, muscle mass, kidney health with keto, fat intake and liver health with keto, hygiene and low energy level